New Orleans is such an incredible city. We're the birthplace of jazz. Our people are second to none. However, we are also a city that's got incredible challenges. One of them is poverty, another is violence. For the last 50 years in New Orleans, we've had over 120 murders every year. Now, the Office of Gun Violence Prevention has three core parts. The first is to deliver public health, non-law enforcement interventions to folks who are at risk. The second is to study those interventions through a partnership with Tulane that we're calling the Policy Lab. And the third is to figure out how to fund those interventions at scale. In 2018, there were 474 shootings in the city. And those shootings had an aggregate cost of about $25.7 million. 70% of that $25.7 million is borne by Medicaid insurers. And so it created this incredible light bulb moment for us where we said, hey, if we're gonna spend $25.7 million every year, what if we can convince some of these managed care organizations to invest some in the front end so we can actually prevent people from getting shot altogether, and they can save the costs associated with their care?
I think the city of New Orleans has recognized that you need new and innovative tools to really break the cycle of violence at an individual and community level. And by bringing outcomes-based financing, I can tell you that we could not be more thrilled and proud to be partnering with such creative thinking around this issue so that we can sustain these programs and they can be around for a long time to make the kind of generational impact that's needed in the city.
Whenever a shooting happens, we get an alert and we then dispatch a member of our team who has social work credentials, either to the hospital to do a needs assessment of the victim and their families, and then to try to provide them with services, or to the actual scene. Part of the thinking in our outcomes-based financing model is that we want to try to address not just the needs of that individual, but also the needs of their family. Maybe they actually need to be moved from a particular neighborhood they're in to another neighborhood. Maybe they need their utilities paid. Maybe what they need is the funding required to get into some certification in another state or in another parish so that they can be successful at welding or working offshore. This isn't a one-size-fits-all approach. It's actually allowing us to tailor how the capital is spent based on the needs of the individual who's at risk so that we can maximize what we care about most, which is keeping them alive, keeping them healthy, and allowing folks to be able to thrive. Never in the country has there been a scenario where these vital public health interventions have been funded through capital markets. The goal here is to create a sustainable source of funding that can allow us not to just address gun violence, but all of these other social determinants of health.
Humana has been, along with the city, just an innovative and creative partner in helping us think about ways that we can really scale this program. We understand that the city has a certain capacity, but in order to really improve health outcomes and do this in a way that can really interrupt violence in the city, we need to understand how health plans will be able to play a role. So health plans can then come in and commit to purpose-driven partnerships that can look at specific health outcomes that they're interested in improving in the city. Investors then can come in and participate by driving capital to specific violence interruption and prevention programs that are tied to those measurable health outcomes. They can also see a monetary return and an improvement in social impact.
I think this is visionary. What's got me so excited is the fact that it takes an interdisciplinary approach to solve really tough problems. And this is the first time that something like this has happened to address gun violence, not only in New Orleans, but nationally.